40 minutes. Hello, and welcome to the Awaken Beauty podcast. I am Cassandra, your organic beauty and endocannabinoid system mentor. And today I am joined with Julie Tebben. She's a good friend. She is a longtime friend. And I can't wait to dig into our subject today because it is one that many, many women have questions around. And it's a really important subject matter to kind of lay the groundwork for women that are looking to see a women's health practitioner, that are interested in functional medicine. And Julie and I go back a good 11 years. And we were both kind of on this transpose of understanding functional medicine and kind of venturing into the wellness industry and functional medicine at large. And before I introduce Julie to you, I just kind of wanted to preface exactly who Julie is. And Julie is a certified nurse practitioner who specializes in the management of functional health and hormone imbalances in young women through women entering their menopausal transition and beyond. With a professional certification in women's health, Julie is also a certified practitioner with the Institute of Functional Medicine. Her new clinic grew out of a desire to focus on helping women live their best and their healthiest lives. She does this through focusing on improving lifestyle factors such as nutrition, stress management, and exercise. But her real expertise is by taking it to the next level by optimizing gut health, reducing toxin exposure, improving hormonal imbalances, and addressing the underlying health immune issues. She intimately understands and empathizes with the plethora of women coming to her office, being discouraged and being told that everything looks completely normal. Have we heard that before, ladies? Leading them to a never-ending internet search to find alternative approaches. Now, I don't think Google is the best approach at all times, all the time. And so I want to welcome Miss Julie. Julie, are you with us?
I'm here.
Awesome. Welcome to the Awaken Beauty podcast. So Julie, like I had noted, and I have met a good 11 years ago, and it's been a real joy to watch you, Julie, and kind of progress over the years of of the industry and how your wealth of knowledge has really grown and your expertise with women and how you've helped many of my clients has just been really a delight. So I think to lay the groundwork today, we're going to be talking a little about some different things, but, mainly we want to have podcasts in the future, but today we're going to talk about functional medicine. What is it? What women should expect? What does it look like to come and see a practitioner like you? And so if you could maybe just share with us, kind of going back 11, 12 years ago, from my understanding, you were a nurse practitioner and you started to gear into the functional medicine platform. What kind of awakened you to, venture into this industry?
So many years ago, I was many years perinatal training.
You're on.
So I started, most of my career was working with women. I worked at the perinatal center at Abbott Northwestern for many years, and I decided to leave just mostly out of wanting to get out of shift work. I went back to graduate school, became an NP, and for a long time I was working in family planning clinics, and it started to feel like my job was diagnosing and treating STDs and giving young girls birth control pills. And so I took some time off, decided to just be a mom for a while. And when I went back, a lot had changed for women with the Women's Health Initiative. And so I kind of had to switch gears in everything that I knew. And I did a little bit of my own investigation, found a job working with a functional medicine provider who started to train me. and basically led me down this path, which honestly was the best decision I ever made. And I don't know that I would ever do anything different at this point. But after 12 years, I've just decided to take it on my own and try to build on what I feel is the best practice to help women. And it's been only a few short months in this completely on my own, but it's been so far a great experience.
That is so great. So what led you to be so passionate about this different way of practicing and really addressing women's care? Because maybe we can kind of, when we talk about functional medicine, it's now becoming a very, very common term. And I think there's still a lot of jargon around there. A lot of us are reading about it on different blogs, but can you really kind of set the stone of like what exactly, how would you explain the difference between functional medicine and conventional medicine?
Cassie, can I stop you for a second? My battery just... So, functional medicine is kind of a parallel to conventional medicine. They're not really exclusive of one another. I think conventional medicine I think of as you go in for your annual exam, or you go in, for your routine screenings. Sometimes you just do all of your preventative medicine kinds of work. I kind of like to say it's really early detection. It's not really preventative medicine. I really think functional medicine is true preventative medicine. But most of us go, we have symptoms, we go in, we have somebody analyze it, and then we are given the standard of care treatment, and then, we go home. But functional medicine is truly taking it to the next level. It's asking the question, why? Why do I have these symptoms? If I have urinary tract infections, that seem to happen a lot. Why is that happening? Maybe it's because I'm in a new relationship and having intercourse more, and maybe now I'm having more urinary tract infections as a result. Well, that doesn't happen to everybody. Why is it happening to you? So conventional medicine is really taking those symptoms and just treating them. I've heard the term name it, blame it, and tame it. And that's really conventional medicine. Everything is about signs and symptoms. And I was trained the same way. But functional medicine takes it to another level and starts asking the question, why? And so that's kind of the beauty of it. It makes it a much better way to treat chronic illness. And most of us, we go in, we have the glucose level done at our regular screening. It's a little bit high. So, okay, well, let's do it again next year and see if it's still a little high. Well, what happens over the next year? What can we do to make sure that this doesn't become diabetes? And that's really what I found lacking in the conventional model. And there's absolutely a place for it. I mean, if I have appendicitis, I need my primary doctor. I need to have an urgent care to go to. I need to have that acute care treatment. There's a complete place for it, but it doesn't work real well with chronic health conditions.
Yeah, so. Absolutely. And I think, if Jeffrey Bland or, some of the godfather of functional medicine and really where this terminology started as far as systems medicine, systems biology. And, if we just take the word systems and put that into the conventional care methodology, to what you're saying, spray and pray, you're going to go and you're going to see somebody for your carpal tunnel. You're going to go and you're going to see somebody for your appendicitis. It's so specialized, right? So we miss out on this systems biology, and that none of the systems are separate from each other. I mean, how many clients have I had, 12 years ago, 11 years ago, even 5 years ago, where we were so quick to just take gallbladders out. And now all these women are missing gallbladders and can't even process fatty acids, in which I've talked about even endocannabinoids and CBD. You make your own endocannabinoids from fatty acids. And so, there's all these dysfunctions when they're trying to treat all the functions separately. So to kind of going into what you're talking about, you really look at, obviously, I think it's, we're far enough in advance enough in natural medicine that you're looking at the whole woman and the whole person. So, to jump right in, I think, it's clear on systems management between functional medicine, whole person, and conventional medicine. We're not here to bog that down because it has a place in a space for women, but, one of the things that I see consistently is I will give your name out. I will give, whether it's a naturopath or a functional medicine, we're still so addicted to this concept of health insurance in the industry. And so I really want to kind of lay out this really kind of nice projection of what women can expect when they work with a functional medicine practitioner, from that first visit to costs. So maybe let's kind of just dissect each section. Let's say I refer somebody to you, Julie Tebben, who is a phenomenal women's health practitioner that has all of these assets that you bring with your experience. They have fear. Do you take health insurance? What does that first visit look like? Am I going to get a bunch of bills for supplements? Can you talk us through that first experience someone contacts you?
So, I get the question a lot, whether or not I take insurance. And, the insurance model is truly built around acute medicine and these annual visits. And again, there's this term medically necessary. Well, if you've gone to your doctor and you think you have a thyroid condition and all of your labs come back normal, you're not diagnosed with a disease. You have no disease diagnosis. That means that you're fine. And you have these symptoms, maybe sleep more, maybe exercise more, maybe change your diet, but there's not really specific advice given as to what to do next. So you walk away and you say, okay, I don't feel any different. I've my insurance has covered all of this. But where do I go next? And what I do is not considered in all cases medically necessary, because you've already ruled out thyroid disease. So repeating your thyroid labs more comprehensively isn't medically necessary. So it's really hard to work in functional medicine within that insurance model because it's not built around functional medicine. So we have to get out of the mindset of what we use our insurance for and what we do outside of insurance. And fortunately, these days, a lot of us have health savings accounts, and they do cover some of these expenses. Flex dollars, flexible spending accounts also cover that. So my advice to people is always try to spend as little as you can on your monthly insurance, and try to put a lot of that money into things where you can take control over what you think is best for your healthcare. So no, I don't take insurance. There are a few functional medicine providers who do, but the risk is that as a provider, I run the risk of getting audited by these companies on a regular basis because I'm not following that model per se. So patients do pay cash to come and see me, and it is covered by HSA and FSA dollars. So if you have that option, that's a good place to invest your money if you want to work with somebody outside of your insurance system. So as far as first visits, because functional medicine really looks at the person as a whole, it's very patient-centered, it's not disease-centered. So I'm interested in everything from how healthy was your mom when she got pregnant? Did she get sick at all during pregnancy? Were there complications? What was her diet like? Was she given antibiotics in labor? Was it a traumatic labor? Was it an easy labor, a fast labor? How was my childhood? Was I breastfed or bottle fed? You really have to go through the entire timeline of a person's life from before conception. And I can't do that all in a first visit. So I have a really extensive intake process. I mean, I have multiple intake forms, one that's just kind of a medical history form, a family history form. I also do something called a readiness assessment, which I'm going to come back to, but the other form is a social history, where I'm looking more at your sleep, your stress levels, who's your support system, what do you eat, what do you drink, what toxins are you exposed to. It's quite extensive, and people have said to me, that really took a long time to fill out. my favorite part, back to the readiness assessment, is really trying to meet the person or the patient where they are at the time that they come in to see me. Some people come in and their biggest concern is money, and I'm fine with that. I'm more than happy to work around your finances. I don't need to do any testing. I can do a whole intake form, and we can start. If you've ever seen the functional medicine model, it's a tree. And
Yep.
if you look at the tree, at
Yep.
the bottom of the tree are the roots. And at the roots, we start looking at, what we call modifiable lifestyle factors. And those are things that we can start working on. If you come to me and you really aren't even sure where to begin, but you really haven't done anything with your diet, you really haven't looked at your stress levels, you really haven't done all of these things, that's a great place to start. And if I can get you sleeping better and help you learn to relax, if I can get you moving and exercising, if I can get you looking at food as medicine, not just something that satisfies a hunger, if I can get you to look at stress and your stress response and how you respond to the things that are happening in your life. And then if we can kind of work on your relationships too. Who's your support system? Who do you go to when you need help? And if you don't have people supporting you, maybe the better investment is to work with me periodically, but work with a health coach, that can hold you accountable and kind of take over that role of the relationship that is going to help you reach your goals. So at its simplest form, I can do that without spending a whole lot of money. But that really requires motivation.
Yeah.
And
I love the
the
term
other,
readiness report. I think that's,
yeah,
I really think that pretty much says it all. Like, are you ready?
yeah.
Are you ready to take care of your health and start to step
Mm-hmm.
down this journey? And you're right on the functional medicine, the drawing is you've got all the tree, and is it the diseases at the top?
The organ
The
systems,
organ
everything is
systems
based,
are at the
yeah, you see
top.
the cardiologist for this, you see the
Right.
psychologist for that, yeah.
So the fragmented piece that we were talking about before,
Mm-hmm.
but, for myself, for yourself, for women that come and see you, for women that come and see me at Beauty Ecology, it really comes to like conversation and really connecting with the woman. And, you said something about relationships and support systems.
Mm-hmm. Mm-hmm.
And when I think about the family nowadays, when I think about marriages nowadays, with 50% of marriages ending in divorce, families are so stressed. Their lifestyle and eating habits are so stressed.
Yeah.
And the women are kind of cultivated to nurture this whole nature of their family, their work lifestyle, that just everything, and run the whole damn system. And I think that's one really, really important part. And that's why I love that the readiness assessment is for them to really, first and foremost, kind of lay it all out on what their life, their reality is, and where that first step is. Because to get from here to here is not a bunch of supplements. It's not a bunch of tests. It's, who's your first resort to support, and, how can I support you? And then where are these other levels of care that we can bring around you to support this? Because any woman's health journey, and you can attest to this, whether it's leaky gut or hormones, as women age, there's this whole host of things that start blowing up. They're like, why didn't anybody tell me about this? So I'm sure you get so many women, and maybe you can say a little bit more about this, of what, how women land in front of you. What are some of those like first questions that you get, or what do they expect from you when they land? And are they saying, well, what supplements should I take, or what test should I take, or I have all these tests, can you just tell me what's wrong with me? You've already kind of related to, you really talk about lifestyle. But so in that first visit, they fill out these forms. What does that first discussion look like after you get past, like, okay, here's all the forms, here's what we're going to do? What is that?
So at that point, I really like the patient to just kind of start over. Yeah, I've read all of your forms. I kind of have an idea of what you're coming in for, but you tell me what you think you're coming in for. You tell me what you think you need to be doing, and what do you think is going on? And then we'll kind of dissect things a little bit. And, frequently, because I'm women's health and because my area of expertise is hormones, people come in and they say, well, I'm having this issue, I think it's hormone related. And then when we really start delving deep into it, maybe it is. Maybe it's stress related, but maybe it's diet related, maybe it's gut related. Maybe it's a medication that you've been taking for a long time, and that's affecting how you're functioning. So you have to kind of go through all those pieces. And frequently when somebody comes in and I even think, okay, this is going to be a straightforward hormone case. And then they're sitting in front of me and I realize there's something going on with their gut function.
Mm-hmm.
And I completely turn it around. Well, now I spend probably, out of my 90-minute first patient visit, I probably spend 45 to 60 minutes of that time in education.
Yeah.
And it's really kind of explaining to people how their gut works, how food works, how absorption works, how, and sometimes if it is associated with hormones, then, okay, so if I'm having gut issues, why is that affecting my hormones? Well, let's talk about all the nutrients that your hormones depend on. And let's talk about stress, physical stress, emotional stress, sleep stress, glycemic stress, which is very diet related.
Mm-hmm.
All of those things affect cortisol. And then there's the whole downstream of, where it goes from there, which is another topic. But when you really start talking to somebody in that first visit, you're kind of narrowing down, here's your primary reason for coming in, but let's try to figure out the why of that. And let's start there. And so I'm never really sure when patients send me emails or contact me in advance and say, well, what testing do you do? Well, I don't know. I don't know that until I see you. I have lots of options, but you may come in thinking you're getting hormone testing, and maybe we're going to look at organic acids. Maybe we're going to look at a stool profile. Maybe we're going to look at food sensitivities. Maybe we're not going to look at anything.
Yeah.
Maybe we're just going to do a thyroid panel. So, and when people come in with a lot of conventional labs, again, it can be helpful for comparison, but it's not really telling me a whole lot that I don't already know,
So on that note, okay, so that the listener understands, what's the difference between, what do you mean by conventional labs? Because my understanding would be, here's your TSH and, your CBC, and everything looks really, really normal. So what's the difference between a conventional lab versus, let's just talk about the different types of labs that a functional medicine practitioner has access to?
So, yeah, I mean, I do, first of all, I will say that I do some conventional labs. I mean, I will do a complete blood count. I will do a metabolic profile and look at, kidney, liver function. But I read it very differently. So just because you're in the reference range doesn't mean I think things are fine. For example, AST, ALT are two really common liver function tests, and the reference ranges go up to 30, 45 sometimes. However, when I see them over 20, I start to go, there's some stress going on here with regards to detoxification. And so does that mean you have a disease? No, it doesn't. But does that mean maybe I want to look a little closer, or maybe talk about let's eat really clean for a while. Let's talk about maybe doing some a little bit of a detoxification protocol, and then reassess and see if, what's better after that, what's not, kind of clear the playing field a little bit. So you can get information from those labs, but those are the types of labs that are done, your glucose, your TSH, your lipids are done on a regular basis. And again, they are looking at something, they are screening for something, but by the time they become abnormal, you probably had months, if not years, to try to prevent whatever you're on the path to, and whatever we're assessing, whether it's thyroid disease, hyperlipidemia, diabetes. If we wait until you have multiple elevated glucose, or we're watching it go up every year, we've missed a lot of opportunity. And I can delve deeper into looking at some of the intricacies of how you metabolize glucose, and maybe get to the concern a little bit earlier, and we can make those lifestyle changes before it becomes a diagnosis. So that's really the difference. And with regards to other kinds of integrative testing, I mentioned organic acids, and sometimes people come in and they have so many symptoms, and they're not living their best life. They're not happy. They don't have energy. They don't have an appetite. They just in general don't feel well. And some of these women, when you say, when did you last feel well? Well, it was when I had my last baby 10 years ago. And ever since then, I feel like everything's going downhill. Well, when you hear that and you start going through all those questionnaires, and you're going, I mean, from the functional model, again, I'm not looking at organ systems, I'm looking at something called core clinical imbalances, but yet I'm seeing problems in every single aspect. And sometimes organic acid testing can help me really narrow it down, because it's looking at detox markers, it's looking at neurotransmitter markers, it's looking at nutritional markers, it's looking at gut markers, it's looking at mitochondrial energy or cellular energy markers, it's looking at fatty acid oxidation. I mean, it really, those are all kind of big terms, but it can really help me say, you know what, I think we start our focus here.
Yeah.
And I can clearly see that there's some issues with your gut, and that's affecting your cellular energy health. So let's start our focus there. And the comment you made about, the supplements, and yes, I do use a lot of nutritional supplements, but my goal is always that there'll be very little that a person requires long term. But it's if you think about it, when a medication is given to you, other than an antibiotic, which is short-lived, but if you're given an antidepressant or you're given a drug to lower your lipids, the expectation is you're going to be on that drug forever.
Mm-hmm.
And when I give a supplement, the expectation is not that you have to be on that supplement forever if you're willing to do the work.
Right.
To get yourself to a point where you're not going to need it anymore. But in the short term, sometimes it requires that in order to reach those goals or to reduce risk in the process. Because some people, you are at risk right now, but we can change that risk.
Yeah.
So we're going to have to use some of this support in the short term. And it's pretty rare that you get somebody that comes in and on a dime, they will change their diet 100%.
No.
It's not going to happen. And it's an unrealistic goal to set, because you're not going to maintain it. So it's baby steps, and you have to work through a process. And that's what I feel like I'm there to do, is help you get to that process. Because my goal is that you don't have dependence on medication. You don't have dependence on nutritional supplements. You're going to have, you're only, the only priority, or the main priority, is really working on the roots of those trees.
Right.
So,
yeah. And I think all the different testing capabilities are really wonderful. But I think it can be excessive sometimes. Like, I'm a data girl and I really love data. Like, I just ordered genetic testing, and I just ordered the Viome, because I want to get all my stool information. And that one organic acid test can then kind of point to the hormones and be like, well, you're not detoxifying your metabolites. And so we need to get you to detoxify first before we can, put any hormones in you. Because then we're just looking at another emotional crazy breakdown. I mean, there's so many things that you can test for that can support each other, but you can only do so much at a time. So when you say you become then, you hold a woman's hand, in which I think all of us women need that, whether it's our practitioner that honestly, truly listens to us. Women just want to be heard, right?
Yeah.
So they want to be validated. They want to be heard. And there's an empathetic transition between, I think, two women that happens in a setting such as yours, or for me behind the chair, that just, there's a sense of relief,
it's a validation.
Yeah. So I think that's a really beautiful relationship that you bring to the table. And then you can kind of step it up with the different tests. So with the anxiety around money, because I can kind of hear some of the women kind of thinking in their back of their mind, okay, well, I really would like to see a functional medicine practitioner. You just started your own women's health business on your own, and you're doing a great job. It's really booming. If a woman comes to you for that initial consult, to set up that first meeting, you do the readiness test, all of the other testing. What does that financially look like for a woman? Now, this is different across the board for everybody, but what would that look like for a woman to come in and see you?
So specifically for me, and the way my practice is set up, is I charge an hourly rate. And the guide, like I said, at my first visit, is 90 minutes. I recommend that everybody schedule that 90 minutes. And if we don't use it all, we don't use it all. You're not going to get charged for it if we're only together 60 minutes. If the problem is fairly straightforward and we're done in 60 minutes. You're going to get charged for 60 minutes. My rate is $260 an hour because of the fact that I'm putting aside 90 minutes. When a patient schedules with me, they have to pay a $60 non-refundable deposit. Now, if a person were to reschedule, obviously that deposit travels with them. If they cancel within 24 hours or they cancel at all, that deposit, that $60 is gone. And that's basically covers, 90 minutes of my time then that wasn't used. And that's the way my policy is. So 90 minutes is that first visit. You're filling out a lot of paperwork in advance. Any records you can get to me in advance is appreciated because I can be completely prepared for that first visit. But as I said, I spend probably the first half hour kind of listening and asking questions and going through the highlights that I pulled out from the questionnaire. And then we spend a lot of time just educating and talking about the functional medicine model and how they fit into that model, and kind of trying to explain what I hear them saying, and then where I see that fits as far as their health is concerned. And then at the end of that visit, it's the two of us making a plan, whether that plan includes testing, whether it includes lifestyle changes. And interestingly enough, I use the example of the person that comes in that's primary concern is money. But then I have all these patients too that come in and they've done everything they can think of. They've researched everything. They've tried everything. They come in, they're already on a whole bunch of supplements and they're just not getting better. These are the people that often come in and they're like, do whatever you need to do.
Yep.
And I can do that too. It's 100% your decision. And I give options. Sometimes it's a matter of, okay, well, I only have this much to spend right now, but I do want to do that eventually. We'll put that into a long-term plan. That's fine. So we do those initial, the first visit, depending on what we decide, happens. And then approximately, if we're doing testing, 3 to 4 weeks later, we do a follow-up visit, and that's an hour. Again, scheduled an hour, not always taking an hour. That second visit is when I do a nutritional exam. And a nutritional exam is very different. I don't do pelvic exams. I don't do annual exams. I don't do the same exam that your primary doctor does. I spend a lot of time looking in your mouth, looking at your teeth, looking at your skin, looking at, some of the things that you just don't typically see done at your primary care provider. And I'm really doing, looking for connections between your nutrient absorption. Do you have a lot of food allergies? Am I seeing a lot of irritation in your skin, telling me there's a lot of immune and inflammatory issues going on systemically? It's a pretty extensive exam, and so I don't do it at the first visit because I haven't really narrowed in on the priorities yet. But the second visit, now I can say, okay, here's some things I'm really interested in, and I can focus on those things in the nutritional exam. And that second visit then is kind of, so did you follow through on the things we talked about at the first visit? What did the tests show? And now where do we go from here? And again, that can be anywhere from, another follow-up in 6 weeks. It can be, if it's a straightforward, I need help with hormones and I'm menopausal and I'm having a lot of menopausal symptoms, maybe it's every 6 months. Mm-hmm. Maybe it's once a year if things are stable and you're on a hormone replacement program and things are going great and you're feeling well. We just have to maybe check in and do some testing once a year just to see if things are in balance, to see if it's still the right thing for you. But there is no cookie cutter approach at all. It's always tailored to what the problem is, how much help the person needs. And I am trying to utilize, as I said before, health coaches a little bit more because sometimes people just need to be held accountable. And yeah, no one's going to pay me, every 2-3 weeks for 30 minutes of my time to just say, let's troubleshoot. Yeah, let's troubleshoot through some of the barriers you're having with your dietary changes. Maybe we just need to have a health coach kind of jump in and see you in between visits with me. So that's the first and second visit. And then beyond that, it really is individualized.
Okay, that's great. Do you find that, this is kind of a random question. There, a while ago, maybe you can bring air to this. Thyroid medication. So I think that sometimes women will sometimes, I don't want to use the incorrect word, but abuse the system a little bit in appointments to just kind of like get their thyroid medication. And was there like a natural thyroid that went off the market like a year ago and then the people couldn't get any more? And I had a bunch of women trying to like figure out who I could send them to get their natural thyroid medication. Could you say a little bit? Do you remember what that was?
Yeah, well, right now there's a shortage on the raw ingredient for desiccated thyroid extract.
Desiccated. Okay.
Yeah, and desiccated thyroid extract comes from pork thyroid. And it's been known as Armour thyroid, Nature thyroid, WP thyroid, West thyroid. I mean, but basically the raw ingredient, that thyroid extract, is the same among all of those products. So people who have been on thyroid medication are now finding that the product that they were using may, be on a back order, or it's not as available as it used to be. I all I can say about that is that I know that some of the, well, let me take a step back. Back many years ago, there was an issue with Armour thyroid, and there was a huge shortage for a while. And I don't know that we completely understand what happened back then, but it was resolved. At the time, a lot of my patients that were taking Armour thyroid had switched to a compounded thyroid extract, and they felt better on that product. And most of them never went back to Armour thyroid. Armour thyroid has some corn gluten in it. It's got starch in it. It's not the cleanest product out there, and people actually felt better on other products. And again, the raw ingredient is the same, but it's all the fillers and the things surrounding the medication that's in that tablet that are different between the products.
Yeah, that's really, really interesting that there's fillers and contaminants in that. I mean, we look at the nutraceutical world and we look at supplements, and there's always, I mean, gosh, metals and even our supplements, and some of the best that they do is COAs on. I mean, in cannabis world, you have to have a COA for every bit, but in the supplement world, we don't. But compounding and compound pharmacies, they are kind of cooking it up back there. So there is somewhat of a component there that you have to really make sure, as far as different food sensitivities and different contaminants and fillers, that might not be an issue. That's a whole other, something I have not thought about.
That is a whole different story. And compounding pharmacies are great because they can really tailor a product to an individual. But I started noticing that one of the compounding pharmacies that I use, he had told me that his distributor said that he can't get thyroid extract until 2020. It was on back order for that long. He was the one that did the research and said that he found that the company that makes Armour thyroid basically bought all of the raw ingredient. And so now all the other companies are really struggling to get the ingredients to make thyroid extract. So there's been a huge shortage, and most of my patients have switched to either NP thyroid or Nature thyroid, which Nature thyroid had its own shortage issues a couple of years ago, but that had nothing to do with this. That had to do with the fact that the demand for Nature thyroid and WP thyroid, which is probably the cleanest product on the market, both of those products were manufactured by the same company. Demand went up. They had to upgrade their manufacturing equipment to keep up with the demand. They were out of commission for a while. Everything was on back order. They come out of that, and now there's a shortage on raw ingredient. So they've struggled. WP thyroid isn't even back into production yet, but Nature thyroid is in various doses. So that's what's going on with thyroid, and it's really frustrating for patients. Many of the pharmacies now are kind of encouraging them to switch to Armour, or encouraging them to switch back to levothyroxine, which is not even the same product.
Right.
And so that's what's going on with thyroid extract right now. And so it's who knows where that's going to end up. I think it's just a matter of finding more of that raw ingredient and starting to manufacture again. And in the meantime, we just take it month by month and see what we can do.
Yeah, well, it can be an issue when, I think they say 48 to 50% of women have a thyroid issue and don't even know it.
Yeah.
you know? I think
Yeah.
about Chris Frickman, who does the vitamin drip here, and it's kind of like all of a sudden we couldn't find any vitamin C. We couldn't get any
Hmm.
vitamin C drips because there's a random shortage.
Hmm.
I'm not a big brother type or a conspiracy theorist. But it's kind of unfortunate that women probably get a little frustrated with you, and you're like,
Yeah.
hey, my hands are tied. Like, I know you're
Yeah.
feeling good and I want you feeling great, but
Right.
I love what you said about the compound pharmacies, because
Hmm.
when I remember back when, and I work a lot with hair loss clients. It's
Hmm.
one of the reasons I started sending you clients in the first place.
Hmm.
There were some topicals that you had, and there was some, I don't know if it was estriol or estradiol that you actually put
Hmm.
in the topical. And that
Yeah.
was the first time I had opened up to, oh my gosh, we can actually put estriol or estradiol into
Hmm.
a cream even and help
And
the
use it on the hair.
metabolism topically. So, women often think, well,
Yeah.
is it my thyroid? I'm losing my estrogen. Oh, I'm all dried up.
Hmm.
I don't enjoy sex anymore. But there's also things where, minoxidil, I have a natural hair loss supplement, but there's even compounding pharmacies that we can work with, that you work with, that can help with topical issues like
Hmm.
that, which is really fascinating.
Yeah. Yeah. I mean, there was it was a T3 estriol, testosterone topical. I think I had several patients using it for a while. I can't say that I don't know that we ever saw amazing results, like it was a
Mm-hmm.
really great cure. Hair loss is a tough one because there's so many different factors that can affect it. Um, and again, you can get into past medical history, you can get into genetics, you can get into
Yep.
nutrition. One of the biggest things I think, and you've probably seen it as well with hair loss, is lack of stomach acid, because it requires stomach acid to absorb your minerals. And
Mm-hmm.
if you can't absorb your minerals, then, and if you're a cycling female that's bleeding every month, you're probably already iron deficient. Well, you need iron to make your thyroid hormone. You need zinc to make your thyroid hormone. You need selenium to make your thyroid hormone. And if you're not absorbing your minerals very efficiently, then you're going to lose your hair.
Yeah. Oh
um,
my gosh, you're right on that. The mineral deficiency is so huge. And you're right on hydrochloric acid. I think, I just had a client yesterday who she's like, oh, I'm already taking all my digestive enzymes. I'm like, but do you have HCl? No. And
mhm,
there's like this hesitancy, and this is part where you come in and help educate the client. Like, you need acid in your stomach. We have this really big, beautiful Trucy machine back here for molecular hydrogen water. Um, that brings up the question, and you'll probably start seeing this more within um, scientific literature. The whole alkaline diet, and it's
mhm,
so incorrect. And we're like trying to. I understand leafy greens for alkalinizing
mhm,
foods, or how lemon alkalinizes your water, but
mhm.
trying to over alkalinize your water and shove that down your stomach and try to push down your pH is the complete opposite of what you want to do. And you're right, like this whole hydrochloric acid deficiency and stress, I think those two
Mhm.
are probably, you know,
And not everybody should take hydrochloric acid. If you have gastritis, if you have
Mhm.
an inflammation in your esophagus and you take high acid, if you take hydrochloric acid, you're probably going to have pain when you do it. That requires a little repair. You have to work on repairing that inflammation and working on changing the diet, and in the short term. But again, it's not just always a straight path from A to Z. And so again, that's what a functional medicine practitioner does, is they try to come up with, how do we get to the point where we can replace low stomach acid levels, improve your mineral absorption without hurting you, because it's not for everybody,
Yep,
you
that's a
know
good point.
um,
That's a really,
so
really good point. Love that. So they've come in
yeah.
for their first, they've come in for their second visit. Then really it's just kind of up to you and the woman to figuring out that relationship together on the
Hmm.
frequency after you figure out where their tests are and things of that
Hmm.
nature. So, I think that this process is a very patient one. I think it's a very one of a woman, to view themselves as this is part of their self-care, and just really meditating and trusting. I think women have a hard time trusting you, trusting the practitioner. Hey, if you got red flags and if it's not a right fit for you, it's not a right fit for you, and that's
Hmm.
okay. It's not for everybody.
Hmm.
Um, but hopping around practitioner to practitioner and not beholding the stress and the trust in the practitioner and to you is also, we short ourselves, so I think, it's a patient process.
Mm-hmm. It is. And, oftentimes people come in and you always have to ask yourself, how long did it take you to get to the point that you're at today?
Good question. Yep.
And if you have been feeling crummy and going downhill for the last 10, 20 years, the idea that we're going to fix this in a few months or even a year is pretty unrealistic.
Mm-hmm.
And that's often where I see people, they'll work with you for a little while, and then if they're not seeing progress, they'll say, okay, this isn't working, I'm going to go find somebody else. And I've seen that happen because some of these patients have come to me, and you can tell they've been to 4 or 5 other providers, and every provider was on the right track, but they never really stuck it out long enough to really wait for the change. And I have seen people that get better. And the funny thing is that sometimes they don't even realize that they're better. It's a couple years down the road, and now they've finally gotten back into their life and they're doing things. And then they look back and they come in to see you and you say, so how is this? Oh yeah, that's not really a problem anymore. I usually go through that problem list. Are you still having headaches? Oh yeah, I haven't needed Imitrex for like 6 months now. And they don't even realize that. Do you see how much better you are in 3 years?
Yeah. See how unconscious we are in our lives.
Yeah, exactly.
Like,
Exactly.
we're always,
It happens all the time.
thinking, we're always looking for like the next bad thing. It's that
Right.
fear-based mindset that
Right.
we're waiting for the next thing to fall or the next thing to drop instead of looking back and really applauding ourselves and hugging ourselves and saying, you made it through that. You made those correct changes.
Yeah.
And yeah, it takes you a while to get there. It takes a while to get out. And it's
Right.
a windy road,
It
It's
is.
like, I'm
It
working
is.
on heavy metals right now. Well, that's not the first step. The first step is making sure that you're detoxifying because, I'm a high methylator, but I'm not a great detoxifier. So there's all these nuances that, okay, now I have to wait for all my channels to be open. Then I can start working on the metals, which isn't fun. 'Cause you can't sleep at night. But there's all of these really kind of not so comfortable steps along the way. But, meditation practice, breathing practices, it's tapping, all of those really realistic things. When I think about stress and when I think about hormones, because women's are always about hormones and these things, is the stressors in our life is what can cause the hormone disarray. It's not always the food. It's not always this. It's the way that we actually perceive things. It's the way we perceive life. I'm sure you could probably see that with a lot of women in different personality profiles. Come in, and sometimes it is a toxicity load, and sometimes it's just how you really, really look and pursue life.
Right. I say this to my patients a lot when we talk about stress, and I hear about all the things going on in their lives. And you know what? You can't change the things that are happening to you, but what stress is really a response to it.
Exactly.
Right. And if you think about other populations and the amount of stressors that they have in their lives, but their perception is completely different because it's something that they're used to. So they may be happy, they may be dancing and singing and things like that, even though they're in a really high risk situation. And then we look at our problems, and they're real problems and they're real to people at the time, but you can't control that. All you can control is how you respond to it. And people need, and women need, because women are caretakers. They take care of everybody else. They want to control all the problems. And they really need to just focus on how am I responding to all of these things that are happening to me? And if you can get people to just change that perspective, cortisol levels start to go down. And if cortisol levels start to go down, appropriately down, then you start having more availability for other hormones, which are now, dysfunctional because everything is supporting cortisol.
Yeah. And your sympathetic, parasympathetic, rest and digest. I mean, when is our body ever really in this restful phase where it can actually absorb and do what it needs to do? Because we're always in this heightened state of stress. I mean, myself included. And so, yeah, I think some of the first things, and I'm bringing awareness to myself is to start asking women, what are some of your meditative practices? And it doesn't have to look like meditation. It could be going on a walk after work for 5-10 minutes just to kind of de-stress and transition from work to home life. But going back to what you said, in those first meetings you have with people, who is your support system? Because we all need it. We all can think we can do it by ourselves. Nobody does life by themselves. It's not possible. You're that one, arm, practitioner arm to kind of be the detective with them. But when they go home and they go to work, like, who are those really trusted people? It could be just one person. For gosh sakes, it could be Joe Dispenza teaching you how to rewire your brain on YouTube. Whatever that is, find those outlets,
Yeah.
So I think that's really great.
Mm-hmm.
Is there anything else that you would want to share, on fears or questions that women come in with? I really just kind of want to, again, we'll have more podcasts. We'll start digging into hormones. We'll start digging into estrogen and, sex hormones and all of those kind of things up ahead. But anything else as far as that first appointment that you can think of that a woman would maybe want to know?
You know what, that first appointment, like I said, I think always the first thing is just that fear of the unknown. If you've never worked with somebody who focuses on functional medicine, I think the cost is the number one fear. But more often than not, at the end of the visit, I feel like the majority of the patients that I see at that first visit, at the end of the visit, they're feeling a little overwhelmed, but they're also feeling very positive. Like they feel like they have somebody that's going to help kind of get them through the fog. And, and I think it always ends up turning out to be a positive experience. It's been very rare that it hasn't been, I think, mutually a positive experience. And I think once you get past that first visit, I think then people kind of know, they can kind of start to digest it a little bit and think about how they can make it work in their lives. So I think that's probably the biggest fear coming in is always cost, and that fear of the unknown. But it doesn't have to be a fear. There's nothing, this is your visit. I'm just a consultant. So many women have been to providers that, say for example, a woman that has bone loss and they've just been diagnosed with osteoporosis and they don't want to take medication. And their provider basically does this, right? And you're going to break a bone. You're going to end up in a nursing home. You're going to die early. I mean, I have heard the worst of the worst as far as what patients have been told by their providers when they're not willing to take that standard route. And they're just looking for another path. And I'm not going to say you have to follow my path, but I'm going to give you another path. And it's your choice how you want to do that. Maybe you want to do a little bit of both. I'm fine with that. I'm not here to tell you what to do. I'm here to provide. You're paying for my advice. I'm giving you advice. What you do with it is 100% your decision. And that's the difference. And, this idea that I'm at a level above, I'm the nurse practitioner and you're the patient and I'm sitting on one side of the table and you're sitting on the other side of the table. That's not it at all. Not at my practice. At my practice, we're equals. I'm providing you advice. You're providing me information, and you're paying for my service. You're paying for my advice, for my knowledge, for my training. And, what you do with it is 100% your decision and there's no guilt.
Yeah. I love that.
I have had people walk away and say, you know what, I just don't think this is for me. I don't think I can do this. That's fine. Maybe down the road, you'll feel like you're in a better place than you can, and you'll know what I can offer, and maybe you'll be back. And that has happened too.
Yeah, I think, that can be in variables. It could be a financial thing. It could be just a lot of fear. It could be they're really overwhelmed. You can't add one more thing to their schedule. So I think there's a lot of reality when we have to start facing our health. Because that does mean changing our nutrition. It does mean changing the way we think. This is whole system. And I really love this. I love how you set the table, right? And it's this one-on-one, peer-to-peer. And I think about, I always go back to the Maslow's law, the hierarchy of needs. At the top of this pyramid, we have we're in our highest state of self. We have relationships, we have our nutritional needs, we have a roof over our head, we have capitalism, which is
Mm-hmm.
somebody that comes to you, they're fairly paying you for the providence that you give them, and you see a
Mm-hmm.
value there. And really all we're doing is helping each other get to this higher state of self, right? It's
Mm-hmm.
our gut, so we're not feeling like crap every day, so that we can live life in joy and happiness, not stressed, not depressed, because so many women are. And so I just want to thank you, Julie, for not only coming into my life, 11, 12 years ago. We share a very, very strong passion for functional medicine and really getting to the root of issues. Not only do we do that for ourselves, you do this for other women. But I really look forward to having you on future podcasts where we can talk about hormone dysregulation. We can talk about sex hormones. There's a lot of things that we'll be able to dig into. But for people that want to know about you, where can they find you, and where would they go to search you out? Your website?
So yeah, my website right now is the best place to find me, and right now it's still a work in progress. As I said, my practice only opened in January, and it was a fairly quick turnaround from leaving the old practice to coming to the new practice. Um, and so bear with me on the website; it's coming. But for right now, you can go to my website, Julie Tebben, CNP for certified nurse practitioner.com. And there's a way to connect if you just want to drop off your email, and I will send you emails when topics come up. There's a way to register as a patient by clicking on the portal button, which is basically your standard electronic medical record, but I love my medical record. It's very user friendly and intuitive. And you can register as a patient, and then all the information is there that you need once you've registered, and most of it is on that first page as well.
Okay.
So that's where you can find me right now, and I am on Facebook as well. What gets posted on Facebook is basically the same as what gets posted in my periodic emails.
Okay, that's great. You have good emails. I saw one just come through that you're providing the Dutch test.
Yes, I love the Dutch test. I've
So
been doing
good.
hormone testing for many years, but that test, and there
Okay.
are other tests out there, but I really like the layout of this, and patients have said, given me feedback that it's really easy to understand. So
Mhm.
that's been really good.
Yeah, I have another question. Where do you see functional medicine going in the next, let's say, 2 years? Is there anything up ahead, genetically, epigenetics? Where do you see kind of things? I've heard chronobiology, so looking at, the biology of time and our sleep and wake cycles. Where do you see
Yeah, I mean, I
kind of
think right now, the big buzzword in functional medicine right now is about the genomics.
Mhm.
And I think that that's been really interesting. I think it's helped guide care, but one of the mistakes patients make, is that they see an abnormal gene and they automatically think, I better start taking a supplement for that. That's not what it means. It just means that you are at greater risk for not absorbing B12. It doesn't mean that you have a B12 deficiency, but that's something we can test for. And it's not just a B12 level, which isn't the greatest way to test for B12 all the time. But I think that's probably the biggest thing. I think right now, I just really want to start to see a little bit more of an acceptance in the general medical community. I look at functional medicine as just another type of medicine, another way to provide medicine. I can't tell you how many times when I see my name referenced in patients' notes that I'm called a naturalist or a naturopath or a holistic provider. And not that those aren't completely untrue, but I'm a certified nurse practitioner. I'm licensed by the state. I'm certified by a national credentialing center. I'm no different than any other nurse practitioner that's practicing out there. I have an NPI number, a DEA number. However, I just practice a different type of medicine and nursing. And so I'd like to see that accepted, because oftentimes what you see is, comments made about what I do is investigational. There's one insurance company that constantly refers to what I do to what functional medicine practitioners do as investigational. But I always come back and say, isn't everything in medicine currently under investigation? We're constantly researching. we're constantly looking for a better way, a different way, a safer way. And that's always happening. And it is in functional medicine as well. So things evolve, things change over time. And I think this is just another change, and it's just taking some time to become widely accepted.
Yeah. Well, I love outliers, and you're an outlier. And I'll tell you what, I think you get paid fairly for what you provide, and the systems are changing. And I know from the number of women that are calling you and other practitioners that I work with, women are demanding their time and their money to be spent more wisely, and they want answers. And, if the fear is around money, I don't want to make this around money. It's around women want answers. And, there's a lot of fancy supplements on the market, from Josh Axe's collagen powder, and it's la 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 la. It's like, slow down, adding all these things. I mean, for gosh sakes, you can OD on vitamin B vitamin. You're just going to have yanked up anxiety, and you're not going to be able to sleep at night. It behooves us as women to not find someone like yourself or a trusted natural provider that looks at the systems biology and the system to really get to the root, and just make sure that you've got your groundwork done, and that you're in that preventative mindset, right? We can't always be putting fires, and that's exactly what you provide. So you are a detective, medical detective, and paid righteously. So, well, I really want to thank you for coming on to the Awaken Beauty podcast. And I look forward to having you in the future, and we'll have many more fun topics to jump into now that we've got the groundwork laid. And I will make sure that in the show notes, all of your information is displayed. And for all of you that are listening, make sure that you find the Awaken Beauty podcast on iTunes. Make sure you hit subscribe, then hit rate and review. And don't just leave a quick comment or your 5 stars. Really, really leave your aha moment, your key takeaways, so that you can help bridge what your brilliance was to other women, so that they can have your aha and listen to the Awaken Beauty podcast in the future. So thank you again. This is Cassandra, your Awaken Beauty, organic beauty and endocannabinoid mentor, and we'll see you next time.